All right, so we are live. We're just going to go ahead and I see we just had the update go out, so we'll wait a few seconds for some folks to join us. All right, I see we've got some people joining. We'll give it a little bit longer here and then we'll go ahead and get going with our updates. All right, awesome. We can go ahead and get started here. Hello, everyone. Thanks for joining us here at Network Health for our Facebook Live today, March 10th. My name is Chelsea, and I'm going to be your host this afternoon as we hear from our Manager of Pharmacy Benefits, Andy Wheaton. We're glad to have you join us to share the latest updates that we have on the COVID-19 vaccine here in Wisconsin. At Network Health, it's important for us to be able to share this information with our community and make sure you guys have the latest on what's going on. During the broadcast, feel free to submit any of your questions around the vaccine in the comments. We'll address as many as possible after Andy shares his updates with us. And then we will also have Kelly in the comments there. She is another member of Network Health, so she can help with any links. We're going to mention a couple of phone number or a phone number during the broadcast here today, so she can help include those links and numbers in there. But first, I would like to introduce Andy Wheaton, let him tell us a little bit about himself and why he is our COVID-19 vaccine expert here at Network Health.
Thanks, Chelsea. So my name is obviously Andy Wheaton. I am the manager of the pharmacy department. I'm a pharmacist by trade, and really have a passion for vaccines and vaccinations. This past fall, I led our flu shot events with our Medicare members, and now just passing on the most up-to-date information on COVID vaccines to our membership.
Awesome. So last week you told us a little bit about this new vaccine from Johnson & Johnson. Can you kind of review that and tell us the difference about the Johnson & Johnson versus the Pfizer and Moderna, the two that are already out on the market?
Yeah, so there's three vaccines that are on the market right now. So Moderna and Pfizer, those are the two that are called mRNA vaccines. So mRNA uses mRNA. It's encapsulated into like a little bubble called a fatty bubble. And that basically protects it from our body's degradation or destroying it. We want to make sure that it gets into our cells and does what it's supposed to do. So once our bodies take that up, our cells start to create the spike protein, actually, and that's what our bodies then create an antibody towards, which in turn fights the coronavirus. So that's kind of how the mRNA vaccines work. These are two-shot vaccines, so normally you get one now and then 21 to 28 days later. They require a little bit more cold storage compared to the J&J one that we're going to talk about a little bit more. And that's just because of the to create that stabilization of the mRNA vaccine. The Johnson & Johnson vaccine is the newest one that was approved late February. And this one uses, it's called viral vector technology. So basically they added the DNA for the spike protein into an adenovirus, which we commonly think of as a common cold. And this common cold virus was modified so it can't create or cause the common cold that we hear of. It can't cause coronavirus either. So just want to make sure everybody's aware of that. Once our body takes that up, we again make the spike protein. We display that on our cells, and our bodies create antibodies towards that. And that's how we fight the coronavirus with these vaccine technologies. The big one call out on this, the J&J vaccine, it's a single dose compared to that 2-dose shot of the mRNA vaccines. So that's one of the big things, big call outs. It's a little bit easier to get. The other thing with this one, like the mRNA vaccines, they're highly effective against preventing hospitalization and COVID-19 related deaths. So any one of these are fantastic. If you have the opportunity, get in line and get your vaccine.
Awesome. So what updates do you have for us this week? Maybe you can talk a little bit about the phases that we're in and then just any other updates that we have heard this week.
Yeah, so right now we're in phase 1B, and we talked a little bit about this last week on who's all eligible at this point. So I'm just going to kind of go through those and then kind of what it looks like for the near future and what that phase 1C is going to look like. So let's talk a little bit about that. So right now we have frontline healthcare personnel, so your doctors and the people that are frontline treating the conditions, residents of long-term care, police, fire personnel, those that are age 65 and older. One of the biggest groups that just got added on March 1st is our educators, so our education and childcare staff. And along with those are the individuals enrolled in Medicare long-term care programs. Non-frontline essential healthcare personnel and some public-facing essential workers like your 911 operators, public transit, and some grocery store employees. Those were the big ones that were officially announced on the phase 1B on March 1st. Now, beginning on this next week, so we heard that the state advisory board that determines the next phased approach. So this would be the phase 1C group. And they're meeting this week to determine who's going to be eligible next. And what we're hearing is that those that have pre-existing conditions are going to be in that next group of eligible membership. So more to come on that. We'll probably have that update next week, but just wanted to share what we know at this point.
Awesome. Good to know we've got more people coming into those phases and that we'll probably have a lot more updates next week on what they're determining this week. So if you are someone who is in one of these groups that is currently eligible and you haven't been reached out to personally or kind of heard from your doctor, how can you go about finding out how to get your vaccine?
Sure. For one of I would encourage people to direct to our Network Health website. We update our links on a regular basis, and we have a fantastic link that the Wisconsin DHS group put together. It's an interactive map. So you can actually click on your particular city within Wisconsin, and then it will pull up the different clinic vaccination sites. And then if you wanted to sign up right there, you can link right to their location. So if it's say a Walgreens or one of the healthcare clinics that are popping up throughout Wisconsin, it'll direct you right there. So definitely use that if you're able to, and if you have the internet and computer. For those that don't have a computer, we have another option that just came out last week. So Wisconsin DHS provided an update for a phone number. It's a hotline phone number. So it also provides vaccine information, as well as they'll help you sign up for the vaccine based on your location. So I'm just going to read this number. You write it down if you know somebody, or if you're one of these people that don't have access to a computer, please distribute this number. It's a great resource. That's 1-844-684-1064. So definitely use that. It's a fantastic opportunity and resource for our state of Wisconsin members.
That's awesome. Yeah, that's super critical for any of our folks out there who don't have, stable internet access or just maybe aren't as tech savvy to use these websites. I know Kelly dropped the 2 links in there. She also included the phone number. And when we follow up and share any of this information, we'll be sure to share all of that information. So if you know someone who maybe doesn't have the greatest internet access, absolutely share this phone number and they'll be able to get those resources too. I think that's really important. Let's see, what else? So you mentioned Johnson & Johnson is the one shot now, and we've kind of heard out there that they're testing just one shot of the Moderna and Pfizer vaccines. Can you kind of touch a little bit on that and kind of what they're finding?
Yeah, so this is something that was in the news recently about, what they were looking at is, can we get enough effectiveness with just one shot of the mRNA vaccine, either Pfizer or the Moderna one? And what the scientists and researchers are finding is, although you get some efficacy there, the recommendation is going to be, get your second shot, make sure you have a plan. We want to make sure that effectiveness, as it was studied in the clinical trials, gets to where it needs to be. And that's the reason for that second dose. So definitely encourage, make sure you have a plan once you get that first dose. We want to make sure that you get that second dose. So
awesome. Yeah, good to know.
Yeah.
So I think there were also in some of the vaccine headlines out there some new information from the CDC once you are vaccinated about gathering with other folks. Can you touch on that and kind of explain that a little bit more for us too?
Yeah, so that just came out this past week, and they provided guidance on, okay, what can we actually do once we're fully vaccinated? Can we get together with our friends? Can we, start hanging out like we normally did pre-COVID? So what we first want to make sure everybody's aware of is, what does it mean to be fully vaccinated? So that's basically 2 weeks after you've gotten your Moderna or your Pfizer or the first dose on your Johnson & Johnson vaccine. So let me rephrase that. So on the Pfizer and the Moderna, that's a 2-dose shot. So it's after the second dose, and you want to make sure you're waiting that 2-week period. For the Johnson & Johnson vaccine, it's going to be 2 weeks after that first dose, which is the only dose that's available. Okay, so just wanted to level set there. So what's changed? So if you're fully vaccinated, you can gather indoors with other fully vaccinated patients without wearing a mask. That's what the CDC is recommending, or the guidelines that they're providing. They also have that you can gather indoors with unvaccinated people from one other household. So the thought here is we don't want to transmit any sort of, obviously, the coronavirus. So if you're secluded with just one other, family or household, that'll limit that outbreak if something happens. And that's only if you have mild to moderate risk for severe illness. So for those other families, if there's a member of the family that has a severe or a highly increased risk of getting COVID, we definitely don't want to take that chance. And so I would still remain socially distanced, make sure we have a mask on, and do those precautions.
Wonderful. I mean, that's exciting news once you're fully vaccinated, just to be able to see people again. I know there's a lot of us who are probably very thrilled to hear that news and to be able to do it safely again.
Yeah. So just an FYI, so heard a little bit more because there's some discussion on the latest CDC guidelines, and then kind of what's next. What do we anticipate to hear from the CDC after this? And they're definitely going to highlight traveling. They're going to highlight what about larger groups? If you went to a conference, so if maybe you're at work and you go to conferences on a regular basis pre-COVID, what does that look like? So they're going to start providing some of that information going forward. We don't have any of those details yet, but as soon as we do, we'll update our website as well as provide this information on Facebook Live.
So in the weeks to come, we'll continue to share. I think that kind of leads into another question we got. It's Wisconsin. We've had a pretty cold, snowy winter here, and spring feels like it's starting to come. What about, spring break season? Any tips for people who are hoping to, get outside and see people a little bit more and potentially traveling? Are there tips that you have that people can do it safely, or just kind of any recommendations around spring fever? Wisconsinites want outside, and we want to get out and do things again.
I know we're all anxious to get outside and as well as start meeting up with friends and family together indoors as well as outdoors. So keep in mind what we just talked about with being fully vaccinated, and remember those guidelines from the CDC. If you're not fully vaccinated, you definitely want to keep in mind be socially distanced, continue to wear your mask. Obviously, we'll keep our hand washing as well, and just make sure we're following those guidelines. We're almost there, everyone. We've done so well over the past year now with being, going through these precautions. And I just want to make sure we stay in line until we get the vaccine, and we kind of decide and see how the expansion of the kind of loosening the restrictions goes. So I just really want to reiterate that fact. Let's keep up the great work that we've done so far.
Right. Yeah, we can see the finish line here, so we got to just make sure we keep social distance, masks, face wash, or hand washing as much as possible. So I have a question in the comments. If anyone else has some questions, feel free to type them in now. But question here is, if locations have available vaccine that hasn't been used, does that open up to anyone to get the vaccine, or does that depend on the vaccine administrator? I think, we've seen a lot of, they've got vaccines that need to be used by the end of the day. Do they open it up to people? How does that kind of work?
Yeah, so I participate in there's a weekly call with Wisconsin DHS, or the Department of Health Services, and what they've provided information on this very trend is, when you get to the end of the day and you have a vial, partial vial left, it has to be basically destroyed if it's unused. So their thought is you want to make sure that you vaccinate any eligible person that's available at that particular moment. We've heard of, hey, pull the snowplow driver, or whoever is out in the parking lot, let's make sure they get vaccinated if at all possible. But beyond that, they don't want any doses to go to waste. So you'll hear of people that may not fit the eligibility criteria, but because of the situation, and if there's 10 minutes left out of a vial, and they need to get it in somebody's arm, they're gonna see whoever is available and offer it to them.
Are there ways that you know of, and I know that it's going to vary greatly depending on the location and kind of the vaccine availability, do you know of ways where folks can kind of be on that call list or in that availability for those unused vaccines at the end of the day?
Yeah, I know certain clinics have kind of emergency lists available. So if you can make it to the location within 15 minutes, we'll give you a dose. I'm not aware of anything in particular that we can direct people to. You can definitely touch base with your provider to see if that's an option, or your local pharmacy if that's an option as well.
Absolutely. Yeah. I think those are all the questions that I see. I don't see any others coming in at the moment. We'll kind of give it a second here. Do you have anything while we're waiting for more questions? Anything else that you wanted to touch base on that we might not have covered yet?
Yeah, just the one thing I just want to make sure remind everybody of is the COVID vaccine is free. We still understand that there's some fraud and some schemes out there on, hey, I'll pay if you pay us a certain fee, we're going to get you in line a little bit quicker, or we'll get you kind of some backdoor access. So I just wanted to make sure that you shouldn't be receiving any information, or you shouldn't be paying for any of this, the vaccine. It's no charge for all lines of business. So if you do run across those, please reach out to us at Network Health so we can follow up on your behalf. We want to make sure that that's being taken care of.
Absolutely. And should folks expect to bring their insurance information with them when they go to get the vaccine?
Yeah, I would bring your insurance card with you. So for Medicare members, this is going to be billed directly to Medicare. So your red, white, and blue card would be the one that I would bring, or that information. So some vaccine clinics aren't even taking the insurance. They're not even billing it. They're just saying this is a service that we're going to provide. If you go to a local pharmacy, they're most likely going to bill for the administration fee, which is completely appropriate. For those that are commercial and exchange, they're going to bill us at Network Health, and we'll pay for it at no charge. So that's just kind of how the logistics go from a COVID vaccine standpoint.
Awesome. Important to know. All right. I am not seeing any more questions here. For anyone watching or anyone who might be watching this after the live, if you do have questions, message us at Network Health or comment on the video, and we will make sure that we can get an answer from Andy either as soon as we have it or in next week's video. Andy, any kind of wrapping? Thank you so much for spending time with us today and giving these valuable updates. Are any other parting thoughts before we wrap up here?
No, just everyone continue to be safe. We're doing such a great job. Keep up the great work, and when your turn is when you're eligible for the vaccine, make sure you get in line and get in line and get the vaccine.
Absolutely. Thank you. Yeah. So we will see everyone back here live next week, Wednesday, March 17th at 1:15. Thanks for joining, everyone. We'll talk to you next week. Bye.
Thanks.